So when we talk about digital, often what we see is that certainly digital presents a lot of opportunities. But often what we have seen during COVID, and COVID actually made it very stark. But even on a day-to-day basis, we are also seeing digital presents a divide and often exacerbates usual divides within society. During COVID, what happened was we had to deliver everything digitally because everything was shut down for a number of months. And that situation persisted for many months, actually. So we delivered education digitally, we delivered public service digitally, we delivered healthcare digitally. And people who did not have access to the digital world, either because they didn't have devices, connectivity, or skills, they were at the short end of the stick. And the digital divide actually worsened health divides as well. So those are the things that we need to explore. If we look at gender gaps in digital access, it's actually very obvious. In terms of mobile ownership between male and female, we're seeing that 84% males actually have access to mobile phones, whereas only 65% women have access to mobile phones. In terms of internet usage, again, about 36% of men use internet over mobile phones, and only 19% use, 19% women use mobile phones. So we are seeing a significant gender gap between men and women. And what are the causes of this gender gap in digital access? So obviously, physical world, we have gender inequality, and it's also replicated in the digital world. Some of our regulatory frameworks, policies, lack of standardization, and interoperability between systems cause some of these gender gaps. And access to formal sexual and reproductive health information also actually contributes to some of this. Now, in the era of smart Bangladesh, we have been in digital Bangladesh for the last 14 years, ever since the Honorable Prime Minister talked about or announced the concept of digital Bangladesh in 2008. Up until 2021, we've been actually building digital Bangladesh. Just last year in December 2022, she talked about the concept of a smart Bangladesh to be achieved by 2041 in alignment with our ambition for becoming a developed country. Now, what does smart Bangladesh really mean? Some of you may have seen this picture. This was a picture that was produced by Boston Consulting Group through a series of consultation last year. The four pillars, the four foundations of smart Bangladesh are smart citizen, smart government, smart society, and smart economy. And from the perspective of sexual and reproductive health rights, if you look at the smart government, the one at the top is the smart healthcare. So what does it really mean from an SRH perspective? So I've outlined or circled the things that are actually relevant to this. Smart healthcare, smart social safety net. I'll talk about how women's financial inclusion actually contribute to positive SRH outcomes. And then you'll see in citizen upskilling, so there is digital skilling that's important for women and girls, and technology and infrastructure backbone. So these are all elements across the four pillars of Smart Bangladesh that contribute to SRH outcomes. Now, in the document, the Smart Bangladesh strategy document, we also see some indicators for 2041. And if you look at the maternal mortality rate, we want to go from 169 per 100,000 births in 2018 to 36 in 2041, a very tall order, so you have to make significant progress. But also if you look at the health insurance coverage, so focusing on health insurance that's tied to SRH outcomes, I think are things that we need to think about during this. And digital plays a very important role in health insurance coverage. So for the universal health coverage that we want to achieve in the next less than 10 years, actually, and then going beyond 2030, in 2041, we want to have significant percentage of the population covered under health insurance. Now, let me talk about some of the innovations that have come from a2i to respond to SRH challenges, including child marriages in Bangladesh. You know that child marriage is a huge problem. And I'll very quickly, since I have a very limited time, I'll very quickly talk about some of these innovations that have come about. And perhaps together as a group, we can think about how to scale up some of these innovations, sustain them financially and institutionally within the public and private sector actors. Now, we launched this innovation called Ma Telehealth Center, focused on pregnant women and new mothers. So during COVID, we ran this for about 18 months. We delivered about 4.2 lakh services to about 80,000 patients. And we covered, obviously, SRH issues, adolescent health, mental health, which is very important for SRH. And we even covered many cases of gender-based violence reporting. And that helped address some of these GBV issues across the board. We just started something called the Smart Pregnancy Monitoring Challenge Competition. So we basically said that during pregnancy, this service, the technology service, will provide a two-way communication between the pregnant women and our health service providers, both in the public and private sector. And this will be connected to the national technology ecosystem with Internet of Things, chatbot, and we're even exploring voice bots with the advent of ChatGPT that has taken the whole world by storm in the last 4 or 5 months that you have seen. And behavior change communication will also be part of this. And what we are hoping is that we will also get some predictive analysis of data that's coming in from all registered pregnant women in the system. So we'll hopefully be able to award the winners within this month. So there will be multiple winners, hopefully, who will work on different parts of this pregnancy monitoring, smart pregnancy monitoring system. Now, this is an important slide. I won't go into the details of all the different pieces. The idea is that in our health architecture, in our health systems, digital systems, we have created a lot of silos. So if you look at DG Health, they have very large systems, DGFP, very large systems, BRAC, CARE, Save the Children, UNICEF. Everybody has very large digital systems, but they don't talk to each other. They are silos, they are large systems, but they are large silos as well. So the idea is to, this is a request that has come from the Ministry of Health, from the Honorable Health Minister, and also the Honorable ICT Advisor to the Prime Minister. So a2i and several other organizations, obviously all the health organizations, public and private, working together to ensure integration and interoperability across all these digital silos. So that will help us understand if we talk about from an SRH standpoint, so what's really happening? So if we can bring in the data of gender-based violence, let's say from Ministry of Women and Children Affairs, if we can bring in data from the public and private sector providers, if we can bring in data from the telcos, just like we did during COVID, it helps us make cohesive and comprehensive decisions. So we'll use unique health ID. Just a few days ago on Sunday, we had a meeting chaired by the Cabinet Secretary on civil registration and vital statistics, so CRVS. And the issue of health ID, unique health ID came up. That will be tied to our national ID and our birth registration system. So we actually talked about how the unique ID will be tied to the national ID at birth through facilities, and also later on through the EPI different touch points, the health ID will also be used there instead of a separate ID for children. And again, this will carry through the adolescent years and the reproductive cycles for women and girls. Let me also talk about an innovation which was not designed to take calls for stopping child marriages, but the citizens made it so. So when we launched 333 as a national helpline in 2018, it was to provide information about government services. But what we saw is that this national hotline was used by neighbors, by the girls themselves sometimes. They would call into 333, and we would be able to forward that call to a local administrator, typically the UNO, and the UNO would intervene, and we stopped about 10,000 child marriages through this. Again, this is outcomes for SRH tied to child marriages. So if you can stop that, that's an SRH innovation. So this 333, this story has been featured in even not only, I mean, there are numerous cases of local media that have covered this, but also in the international media. 333, stopping child marriage, has been covered. Let me talk about the education issues. So we have a children portal, adolescent portal called Connect, KONNECT, managed by Ministry of Education and Ministry of Primary Education, so supported by a2i. And we created a mental health support corner there. Again, it has 3,000 plus content to web and social media, and a lot of them actually focus on SRH issues, as you can see, mental health, nutrition, adolescence issues, relationship, and then there is a helpline also. Let me move quickly. There is also a training platform called Muktopat. There is a mental health course that we had about 14,000 people enrolled, 46 contents right now. And this is again a national platform where a lot of the actors that are working on SRH issues can contribute content. So we have partnership with USAID and other organizations. So I hope that going forward, a lot of you will consider this as the national platform for providing course content on SRH. The last thing I want to talk about is really the relationship between women's economic empowerment and sexual and reproductive health. So we are actually seeing, and this is international research, not research that we have done, that economic empowerment actually relates to positive SRH outcomes. On the women's financial inclusion, we've actually created something called the Shathi Network. It's a new initiative which has about 200 or so women that go door to door to households and provide financial access, so banking and mobile financial services access, literacy to actually women. So again, empowering women financially. So this again has positive outcomes to SRH. We also created a financial inclusion advocacy forum, Women's Financial Inclusion Advocacy Forum, that's helping in an indirect way for a positive SRH outcome. And we are focusing on creating new financial products for women for credit, insurance, specific needs of women actually are being considered there. My last slide in terms of recommendations, and again, I hope that I can stay on for a bit longer, although there is another competing meeting that I have to join online, but I want to hear some of the other presentations and participate in the Q&A. So essentially, cross-cutting digital technologies create new opportunities and reduce digital divide. I talked about breaking the silos. We have a lot of digital silos within the health ecosystem. They need to be bridged. Significant coordination, collaboration efforts need to happen. I mean, we don't have enough right now. So again, tied to the silo breaking. Focusing on gender issues and specifically SRH issues in terms of access and ownership of digital technologies. And then tying this to the SRH outcomes. So I think I was looking at some research where they talk about how if we can bring in different types of data systems together, then we can make comprehensive policy decisions and health interventions to bring out positive SRH outcomes. Thank you very much for your kind attention.